So I chose to study medical physiology and therapeutics because I'd already thought about the career I wanted to go, and being a perfusionist was something that I wanted to do. This course seemed to have a lot more anatomy and physiology. It wasn't just lab-based. Obviously, the reputation of the university is a great one, and I lived in Derby, so it seemed like an obvious choice to come up here and do the course. The best part of the degree for me, there was a couple of bits. One, the fact that you got to do pro section in anatomy, and the other one was having the choice to gear it to where you wanted to go. So in the second year I was able to choose physiology modules, cardiac and respiratory, whereas I could have gone down the more lab-based modules, but the best thing for me was to be able to choose those physiology modules. So I would definitely recommend the course to other people. There's a lot of wide variety of careers that people have gone into, so medicine, further degrees in medicine, further training, PhDs, masters, and people who've gone into medical sales and then healthcare science. The course has that flexibility that you can gear it, so the lab-based side of the course or the more physiology-based side of the course, and you can gear it in the direction that you want to go in, especially with the huge variety of final year dissertations that you can do. So I'm a clinical perfusionist, and that involves putting patients onto a cardiopulmonary bypass machine, which is used during open heart surgery. The machine is used to give the surgeon an empty and still heart to work on so that he can see what he's doing, places stitches without being completely flooded with blood, but also at the same time the blood is being diverted away from the heart, reoxygenated, and then delivered to the rest of the tissues so that the patient is safe for the hour or more that it takes to do the operation. So the degree has helped me in my career by firstly the huge amount of anatomy teaching that we have. When we're perfusing the patient, obviously we need to know the vascular pathways that the patient has. Sometimes we are only supplying blood to different regions while other regions are being operated on.